Good morning, everyone. My name is Chloe, and these are my associates, Merrin, Natalie, Shamim, and Kimberley. Our project is on occupational therapy and the criminal justice system. We will now provide you with a brief overview of our entire project. In June 2020, more than 41,000 individuals were incarcerated in the Australian prison system. A significant number of these individuals were from vulnerable groups such as Aboriginal and Torres Strait Islander peoples, individuals with an intellectual disability, women, juveniles, and individuals with a mental illness. This highlights the need for further research into why vulnerable groups are predisposed to entering the prison system. This project aims to explore the role of occupational therapy within this setting and the role occupational therapy has in supporting rehabilitation, reducing reincarceration rates, and supporting re-entry into the community. Furthermore, this project will also highlight the occupational injustices experienced by these groups, as well as the current occupational therapy interventions and initiatives that are currently being implemented. Finally, we have several recommendations for future research, OT practice, and related policies. So firstly, we'll be discussing Aboriginal and Torres Strait Islander peoples, following by individuals with an intellectual disability, women, juveniles, and finally individuals with a mental illness. I will now hand over to Natalie to discuss the role of occupational therapy.
In regards to the role of occupational therapy in this setting, Connell 2016 suggests that OTs in this setting should work to prevent occupational deprivation, promote engagement in meaningful activities, facilitate community reintegration, connect clients with other relevant support services prior to community reintegration, and advocate on behalf of vulnerable subpopulations. I will now pass on to Merrin, who will speak to you about Aboriginal and Torres Strait Islanders.
Aboriginal and Torres Strait Islander or Indigenous people experience markedly higher rates of incarceration in comparison to their non-Indigenous counterparts. Indigenous people make up approximately 3.3% of the total population. However, they account for over 30% of Australia's total prison population. Data suggests that in 2016, Indigenous Australians were 16 times more likely to be imprisoned than non-Indigenous Australians. Potential reasons for these disproportionate incarceration rates have been thoroughly documented. Proximal influences include exposure to violence, alcohol abuse, mental health issues, unemployment, low educational attainment, homelessness, and low socioeconomic status. However, it has been implicated that these factors are in fact a direct result of historical injustices experienced by Indigenous Australians. This has subsequently resulted in intergenerational discrimination and trauma, condemning many Indigenous people to social disadvantage and alienation from the criminal justice system. In correctional centres, all aspects of the occupational environment are closely controlled. Inmates are told when, where, how, for how long, and with whom they can eat, work, and rest. This results in occupational deprivation. Occupational deprivation occurs commonly in prisons, in part due to legal and institutional risk management policies, and in part due to the cultural philosophies adopted by correctional institutions. Occupational engagement is therefore perceived to be a reward rather than a right or method of rehabilitation. Social isolation is also commonly reported by inmates. Although it is not an experience exclusive to Indigenous offenders, it is posited that they are at increased risk due to the vast distance between prisons and their families. In addition to the difficulties posed by the physical distance, socioeconomic status also plays a significant role. Research shows that inmates are at increased risk of reoffending if they're unable to remain in regular contact with their families. This is of particular concern for Aboriginal and Torres Strait Islander peoples, as 76% were repeat offenders in 2016. Finally, occupational imbalance occurs as time is dominated by self-care and leisure occupations. This issue is exacerbated for Indigenous inmates who are also separated from law, language, and culture, which are intrinsically tied to their identity. Research shows that the programs that are provided for prisoners are typically targeted at non-Indigenous offenders. These programs are often culturally insensitive or isolating, as they focus on mainstream Anglo-Australian culture. They therefore run the risk of exacerbating feelings of isolation and distress, rather than achieving their intended goal of reducing recidivism. Without intervention, the implications are clear. The needs of Indigenous offenders are not addressed, and inmates return to society without the skills required for community living. This ultimately results in a return to criminal behaviour and engagement in illegal occupations, leading to a cycle of imprisonment and disadvantage. Moreover, practitioners working in this setting have linked the risk of reoffending to several occupational issues, including poor time management, depleted living skills, unemployment, and homelessness. It is therefore clear that the occupational therapy profession has an integral role to play in the Australian criminal justice system. In the past, research has traditionally focused on the review of occupation-based programs targeted at the general population rather than Indigenous offenders. Thus, the purpose of this chapter was to evaluate interventions designed specifically for Indigenous inmates. However, the search revealed very few published evaluations of prison-based interventions. Two relevant studies that were identified were a quantitative study assessing the Ending Offending Program and a qualitative study evaluating the Babin Miminyang Program. Several conclusions can be drawn from the review of these prison programs. Firstly, culturally safe and sensitive content increases Indigenous participation. Secondly, Indigenous-led interventions reduce feelings of alienation. Thirdly, programs are more effective if a trauma-informed approach is adopted. Finally, and perhaps most importantly, this review highlights the importance of interventions designed and delivered specifically for Indigenous peoples. I will now hand over to Shamim to discuss individuals with intellectual disabilities.
Approximately 25 to 30% of these individuals are incarcerated due to lack of education and homelessness. Moreover, these individuals have the desire to seek friendship with others, and due to their vulnerable status, criminals take advantage of them and entice them into their criminal activity. Homelessness can contribute to incarceration for these individuals. Limited funding for appropriate support services can contribute to homelessness. These individuals living on the streets are a victim of criminals and may participate in criminal activity as a way of addressing their limited support systems. Lack of education and marginalization from an early age can also contribute to criminality, as lack of education is associated with poor judgment and impulsivity. Incarcerated individuals with an intellectual disability have difficulties engaging in the occupation of self-care due to lack of privacy and knowledge. Due to the structure and routine, individuals are unable to complete occupations of self-care privately. Another occupational injustice is insufficient time allocated to engaging in productivity, as most of the time is spent within the cell. These individuals often have difficulties engaging in leisure occupations or participating in social interaction due to a development of pro-social behaviors and attitude necessary for social interactions as they are incarcerated, or as a result of these skills not being present before. Moreover, the occupation of sleep is also impacted. Individuals spend over 90% of their time in their cell sleeping. However, they had difficulties engaging in sleep due to comfort, noise, lighting, and stress. The occupational injustice of lack of privacy and knowledge while engaging in self-care can have a significant impact on an individual's motivation and autonomy whilst in prison and upon release. Furthermore, leisure and productivity occupations are affected due to the nature of the environment, as individuals spend most of their time confined in a cell, thus affecting their autonomy. Individuals are likely to be lethargic and out of routine when asked to engage in occupations due to their routinely habits they are constantly in. Lack of sleep can affect an inmate's participation and performance when engaging in self-care, social interactions, educational programs, group work, and relevant training. Individuals with an intellectual disability are more likely to serve a longer sentence than those without. Furthermore, their disability is often not detected due to the individual's inability to recognize or understand that they have an intellectual disability. These individuals do not receive satisfactory treatment during the time they are incarcerated, which can result in an increased risk of a repeat of offensive behavior within the community. Occupational deprivation can also cause behavioral and social discrepancies that can hinder the ability to successfully transition into the community. Another implication is the lack of access to appropriate social support, education, employment, adequate housing, and healthcare, which makes it difficult for people to regain their lives, creating various challenges whilst integrating into the community. As a result of these challenges, individuals often believe that they are unable to provide themselves with security and a stable life by falling into habits of offensive behavior. A current intervention implemented is an occupational therapy community living skills program, which is aimed at individuals with an intellectual disability who had been in prison for more than 10 years and were transitioning into the community. Topics that were addressed were socialization, technology, finances, health, and employment and education. Another initiative implemented is an educational program for incarcerated individuals to provide technical, academic, and appropriate workplace skills prior to release to facilitate transition into the community. Fournier, Geller, and Fortney 2007 studied the effects of a dog training program in relation to reduced criminal behavior. The program had benefited inmates to reduce criminal behavior, improvement in social interaction, increased participation in the therapeutic community, and reduced anger management skills. I will now pass on to Natalie, who will discuss women within the criminal justice system.
Women make up a small percentage of the prison population. However, over the last decade, the number of women entering jail has doubled. According to the New South Wales Bureau of Crime Statistics and Research 2018, there are two reasons that female incarceration rates have risen. Firstly, there is clearly an increase in the number of women presenting before criminal courts compared to civil courts. And secondly, many of the women presenting before the court are repeat offenders, which necessitates harsher penalties. There may be other social determinants at play. Consider that 85% of women in prison have a background of violence and abuse. And many women in prison have experienced homelessness, debt, have had difficulties with substance abuse, and have had poor educational and employment outcomes. Occupational injustices experienced. Article 5 of the Universal Declaration of Human Rights, 1948, states that all humans have a right to not be subjected to degrading treatment or punishment. Strip searching, however, is a common practice in prisons, and it is degrading and undermines personal autonomy, leading the woman to feel victimized and a lack of control. Another occupational injustice that women who are incarcerated face is related to motherhood. Most women in prison are mothers and sole carers of their children. These women are unable to see their children grow up, and some women in other countries report being separated from their child at birth. Article 25 of the Universal Declaration of Human Rights highlights that everybody should have a standard of living acceptable for the health of themselves, including adequate access to healthcare and healthcare-related information. First and Clark, 2012, conducted a survey on state prisons throughout USA and found only 19 facilities provided a range of prenatal and postnatal care to women. Lack of access to mental health services and treatment whilst in prison is another occupational injustice that women face. This is highlighted by the fact that women in prison are much more likely than the public to have serious mental health disorders, often with complex dual diagnoses. Finally, Article 24 and 26 of the Declaration of Human Rights, 1948, states everybody has the right to access leisure as well as education. However, one woman described that during her time in jail, she only received 1 hour of education per week and spent most of her time doing nothing. Certain aspects of the prison environment, such as prison routines, sentence duration, and a lack of resources, leads to poor vocational training outcomes for women. The implications of women not having OT intervention include that women re-entering the community may find themselves unable to cope with the transition because they have less support available to them and have not developed the necessary skills to adapt to the transition. This in turn may lead to recidivism and consequently imprisonment. The cycle of reoffending and re-entering the criminal justice system contributes to family breakdowns and poor physical and mental health for these women. The cost to society is also large. In 2014 and 2015 in Queensland, it cost the Australian taxpayer $296 per day to keep one woman in prison for a non-violent crime. Some occupational therapy initiatives that have successfully provided intervention include a project by Smith 2017. This focused on delivering an evidence-based program centered on teaching incarcerated women emotion regulation and problem-solving skills related to anticipated challenges that they may face upon re-entering society. The aim of this program was to teach women these skills so that upon release, they would have the skills to respond appropriately to life stresses instead of returning to engage in criminal activities. Scram and Monash implemented a life skills program with women and taught them skills related to problem solving, stress management, anger management, parenting, and employability skills. Sisters Inside 321 Transition Support Program worked over 18 months with the women and their family to provide support in establishing the women's housing and income situation upon release from prison and provided targeted support with schooling and financial assistance. I will now hand over to Kim to discuss juveniles.
So why are children as young as 10 years old and adolescents being incarcerated? Well, Willis 2019 state that there are underlying influences that cause young individuals to commit crime. Youth who have experienced childhood trauma are influenced to participate in risky behaviour. Childhood removal from Indigenous Aboriginal communities also increase the likelihood of that young individual coming in contact with crime. Youth who are born or live in homelessness result in survival offending, as well as children and adolescents with a cognitive impairment having difficulty participating in either school or employment, thus increasing the likelihood of participating in criminal offence. The national policy on the left refers to young offenders given suitable accommodation. However, this policy is breached as children and adolescents from Queensland are not being sent to youth detention, but to the watch houses. This in itself is an injustice as these watch houses are specifically made for adults. There have been several cases of juveniles that are experiencing occupational injustices, which includes being denied the right to attend to their own self-care in dressing, showering, and grooming. These juveniles are also denied sleep as these watch houses provided insufficient bedding and the artificial lights are always on day and night. The national policy on the right refers to a procedure to address offending behaviour. However, watch houses in Queensland and youth detention centres in Western Australia are breaching this policy. These facilities in particular are taking away the right to leisure and recreation as juveniles are being held in isolation cells and given little to no time in outdoor activities. Due to the occupational injustices caused by the criminal justice system, this has resulted in physical and psychiatric decline, resulting in self-harm and suicidal attempts. The main implication of children and adolescents re-entering the community without occupational therapy intervention is juvenile recidivism. Few and Charles, 2001, has stated that young individuals who do not occupy their time effectively result in occupational imbalance. Because more time is spent on passive leisure activities over productive occupations, this contributes to the likelihood of juvenile recidivism for this group. It has also been mentioned that young individuals have less thoughtful and reflective decision-making skills, which affects their lack of self-control and increased need for pleasure, thus increasing the likelihood of reoffending. There has also been a link to young individuals reoffending due to weak attachments to parental figures, lack of opportunities, and moral beliefs. Peer influence has also been stated to be an influential factor in juvenile recidivism. In order to mitigate juvenile recidivism, there are 3 types of interventions used by occupational therapists working with children and adolescents in the criminal justice system. Through research, training and education-based interventions have appeared to be the most common to implement among juvenile inmates. Occupational therapists taught life skills training through play-based programs, as well as through general education. Occupational therapists also used education to show juvenile inmates of community services that can help them develop their life skills, especially in education and employment. Training and educational-based interventions can reduce recidivism in youth offenders as it provides them with the acquisition of healthy full life skills to re-enter their communities. Mentoring-based intervention is also an effective way to reduce juvenile recidivism, as occupational therapists can guide adolescents and children on how to approach occupational challenges in their later future. For children who reoffend due to acts of violence and aggressive behaviour, sensory-based interventions have been effective. Sensory-based occupational therapy can mitigate juvenile recidivism as it provides young individuals with coping strategies to reduce the likelihood of becoming aggressive or violent when out in the community. Now, Chloe will talk about individuals with a mental illness.
Individuals with a mental illness can experience discrimination and stigma, leading to reduced community and family support, as well as limited opportunities for employment and public housing, thus can turn to crime as a means of providing for their lifestyle. This higher prevalence has a strong correlation with determinants such as substance misuse and overall risk-taking behaviour. A significant number of this population group have attempted to receive psychiatric support prior to entering the prison system, with a large percentage of them disclosing that they had been prescribed certain medications such as antidepressants, antipsychotics, or mood stabilizers prior to entering. However, only a fraction of these individuals were taking the prescription medication at the time of their arrest, which further reinforces that individuals with a mental illness are not receiving adequate, regulated, and continuous psychiatric treatment. The main occupational injustice experienced by individuals with a mental illness within the Australian criminal justice system centres around mental health service provision. There are several government policies and procedures that are designed to underpin the criminal justice system. However, close to 20% of all inmates in Australia are held in privately run facilities, therefore making these not as heavily regulated. These disparities further complexify the provision of adequate services, as well as the relationship between the institution, inmates, policies, and communities. This in turn leads to occupational injustices for this population group residing in the criminal justice system, as whilst access to healthcare is a human right, this is not regulated or necessarily upheld entirely within the criminal justice system. This injustice can exacerbate occupational deprivation as they continue to experience occupational imbalance as a result of their impaired thoughts, judgment, and mood. People with mental illness frequently experience difficulties maintaining sleep due to difficulties disengaging from their negative thoughts and feelings. Rest plays a foundational role in maintaining occupational balance as it enables the rejuvenation and restoration of the individual's physical and mental health. They also experience challenges completing their self-care occupation, such as maintaining their overall personal hygiene, due to experiencing a reduction in their self-esteem and self-awareness. Moreover, they have reported a loss of autonomy in their self-care occupation due to the institutionalisation process, where individuals are required to adhere to foreign rules and regulations. They also often experience reduced opportunities to engage in leisure and productivity occupations due to prison regulations outlining the allocation of time spent engaging in these activities. Some Australian prisoners have also reported spending up to 22 hours per day confined in their cell without the possibility of engaging in meaningful social interaction. In terms of the implications, it's widely known that prisons are often lack the provision of basic services due to funding limitations as well as overcrowding, consequently making it difficult for the system to facilitate targeted intervention programs. This in turn means that these individuals often go without the necessary treatment to address their mental illness and are often released into the community with insufficient discharge planning, leading to an increase in incarceration rates in comparison to their inmate counterparts without a mental illness. These individuals often feel ill-equipped to navigate the community once released due to feelings that their underlying mental health concerns have not been addressed. It can be argued that these feelings, in addition to a lack of social support, often contribute to these individuals turning back to crime as a means of safety and security, as it's all they know, as well as a way of trying to compensate for the fundamental life skills they are lacking. There are several pre-existing initiatives and interventions. However, the specifics regarding these are difficult to attain due to information restrictions on public access. One Australian initiative was the development of personalised safety plans for individuals with a mental illness in the criminal justice system, facilitated by the implementation of a multisensory room, giving these individuals a safe environment that can assist in their engagement in crisis de-escalation and the preventative strategies with this sensory room, including items that provide an array of sensory stimulation. Other commonly used interventions include psychosocial rehabilitation programs designed to develop the inmate's life skills through education in areas such as stress and anger management techniques, interpersonal and social skills, self-development, and self-maintenance. I'll now pass on to Natalie to discuss our recommendations.
We recommend that OTs use the existing evidence base wherever possible and use a culturally sensitive, occupation-based and trauma-informed approach, while simultaneously considering the social determinants which may be influencing occupation performance. However, it is necessary that there is an increase in research and funding allocation to ensure the continued development of standardized instruments and evidence-based interventions in this practice setting.
So our take-home message is vulnerable people incarcerated deserve the right to participate in meaningful occupations. Through incarceration, many individuals experience a loss of occupational engagement and empowerment. This occupational deprivation without appropriate support can lead to an increased chance of recidivism. As occupational therapists, it is important to highlight the significance of engaging in meaningful occupations for incarcerated individuals to help improve their quality of life whilst in confinement and reduce recidivism when released into the community. Thank you.